I want to talk to you about something that I've been doing at this hospital for about the past 3.5 years, which has been using patient-specific implants to solve the problem of arthritis. These are pictures of partial knee replacements from a company based out of Boston that has a proprietary technology for actually making implants specific to your body, so that rather than as surgeons and as patients having to choose between size 1, 2, 3, 4, 5, what we actually do is we take images of your knee and then have the company make the knee replacement that fits your knee, which makes a lot of sense to me. And so if you look at these pictures, on the left, this is what's called a unicompartmental knee replacement, which replaces just the ends of the bones that are worn on either the inner or outer part of the knee, or what's called a duocompartmental knee replacement, where we take this implant and extend it around the front of the knee in case the kneecap is worn. This by far is more commonly implanted than this one over here, but I'm showing them to you both just to let you know that they exist. And so the question is, why would you want to choose a partial knee replacement over a total knee replacement? Well, there are a lot of reasons for that. When you implant a partial knee replacement, you're removing only the part of the knee that's diseased and you're leaving the rest of it that's normal alone. And so in my opinion, what God gave you is always going to be better than what man made. So if we can keep part of your knee that's still good, that to me is an advantage. But just as importantly, all of the modern total knee replacements that are available on the market involve cutting at least one of the ligaments in the knee, which is called the ACL. And so if you cut a ligament in the knee, there is going to be some motion in the knee or some looseness that wasn't present before, which isn't the end of the world. We have ways that the mechanical engineers have figured out to get around that. But if you can implant a part of the knee that doesn't cut any ligaments, which is what these partial knee replacements do, and leave your normal ligaments alone, and leave the rest of your knee alone that's not involved with arthritis or disease, and that would seem to be a pretty good choice. So why would we choose these? Well, in general, if you're young, if you're one of these guys or women that have had 2 or 3 ACL operations or have broken your knee and had surgery, and you're 38 or 40 or 42 years old, but you've got now end-stage arthritis to the point where you can't play with your kids and you can't go out dancing with your wife or what have you, then a partial knee replacement might be a good idea, because you're going to remain very active, and you're going to want a knee that feels as natural and as normal as possible. Conversely, if you're very old and you're not very active, you're winding down in life and taking things much easier than you used to, then you may not need to have your entire knee replaced. You may be perfectly happy having only the part of the knee that's the worst part replaced and having a surgery that's much easier to recover from. In order to have this, you have to have normal knee ligaments. If you don't, then this operation doesn't work. You have to have no inflammatory arthritis, which means you can't have rheumatoid arthritis or lupus or gout. Otherwise, we're concerned about arthritis spreading to other parts of the knee. Can't have an infection. You can't have any gross malalignment, meaning that if you're terribly bow-legged or if you're extremely knock-kneed, this procedure doesn't tend to work so well. And you have to have arthritis confined to only one part of the knee. So if these partial knees are so good, why do we do total knees? Total knee replacement is still by far and away the most commonly done procedure for knee replacement, and there are a number of reasons for that. Most people don't have arthritis that's confined to only one part of their knee. They have it all over the knee. And so if you have arthritis in 2 or more of your knee compartments that we just talked about, then a total knee replacement is a better operation. Many people that have had arthritis for years and years and have put this off become either bow-legged or knock-kneed because of the wear pattern of the arthritis, and they're no longer a candidate for a partial knee. And so that's another reason why we do total knee replacements. Lots of people that develop arthritis have had ligament tears in the past, especially ACL tears, and if you don't have a functioning knee ligament, total knee replacement is a much better option for you. Or if you've got one of these other conditions, lupus or rheumatoid arthritis or gout, this is a much better procedure. So the partial knee advantages would include smaller incisions. Typically we put these in through about 3 or 4 inch incisions as opposed to 7 or 8 inch incisions for total knees. We were able to preserve the ligaments that I was talking to you guys about a few minutes ago, including the ACL, so that many people that have these, and you ask them how it feels, we're actually involved in a multi-center national study on the outcomes of these patient-specific partial knees. But when we interview these patients in our office 2 or 3 years after the procedure, they just say it feels more natural. It feels feels like it's my knee. It doesn't feel like it's a artificial knee, and that's what we're looking for. The hospital stay is hardly ever more than one night. Most people have this done in the morning and go home the following morning, so that's a good thing as well. And the recovery is quicker. We're not cutting as much skin. We're certainly not cutting any muscles or tendons, and we're not cutting out any ligaments, so that people can recover from this typically quicker than they would a total knee replacement.